You mentioned that you're about to have your first baby, so congratulations on that. And a lot of well-meaning people that you know have been telling you to just kiss your freedom goodbye and don't expect to ever sleep again. And to a point, these things are true, but it's all temporary. And there are so many special things about having a newborn. I'm sure you've had many family and friends tell you all of those things. But I think it is important to go into it with a realistic expectation and understanding of the fact that it is going to be hard. It is not all bliss and butterflies like everyone makes it out to be, and I think we do ourselves a disservice by not talking about the difficult things. So in order to help you have an optimistic outlook on it and to do well after your baby's born, I'm going to give you 5 tips to thrive. Just remember to be happy. BEHPY. It's an acronym. So let's start with B. B is for bonding, and bonding is so important. That's what, gets you up in the middle of the night to take care of your baby and gets you through all of those hard, stressful times when you're worried about everything after your baby's born. You love them so intensely, but that bond doesn't come immediately for everyone. Some mothers bond with their baby when the baby's still in the womb and it's just intensified after delivery. Some take a while to bond, and that's okay. It's also really important for dads to bond, and for many of them, it doesn't happen until after the baby's born. And the time that you bond with your baby can be affected by delivery. Maybe there are complications afterwards, and the baby and mom had to be separated. Maybe the baby doesn't look the way you thought they were going to look. They often look a little bit funny after delivery, so don't be alarmed by that. They look entirely different in a couple of days. They don't have a swollen cone head or swollen face, or some are born with bruised faces. All of these things are normal. But some of the things that will help you bond with your baby are just simply taking care of them, feeding them, changing them, loving them, holding them, and doing skin to skin and breastfeeding. Those are especially important. Dads can also do skin to skin too. This should be done in the hospital as well as at home after you've left the hospital. E is for expectations. Like when it comes to sleep, you are going to be massively sleep deprived. And I think one of the best pieces of advice I could give you is to just tell yourself that sleep is overrated, and for a short amount of time, you are going to be sleep deprived. So expect that. Small babies need to nurse every 2 to 3 hours, and their tummies are small. They can't hold much volume, so they need to eat frequently during each 24-hour period. And they're also growing rapidly, so they need almost constant nourishment. And this 2 to 3 hour time frame is from the beginning of one feeding to the beginning of the next. So it can take you an hour to feed your baby, burp them, change them, and put them back to sleep. So let's say you woke up at 1 a.m. to feed your baby. It took you 45 minutes to nurse them, a couple minutes to change them, and a few minutes to get them settled down and back to sleep, and then they're up again at 3 a.m. You may be waking up every hour, is what it seems like to you. Babies actually sleep 16 hours out of each 24-hour period, but it's just never when we want them to. As babies get older, though, usually between 6 weeks and 3 months, they start to go longer in between feeding sessions as their stomachs get a little bit bigger and they start to understand the difference between night and day. And by 3 months of age, most babies are well on their way to sleeping through the night, or at least a large enough chunk that you feel like you're sleeping through the night. Maybe you give your baby their last feeding at midnight and you're able to sleep till 6 or 7 in the morning, and it will be heaven sent the first time that happens. Another thing to expect is crying. Crying is the only way that a baby can communicate with you. So you'll get to know what your baby's cries mean. It might mean that they're hungry, tired, they need their diaper changed, they're uncomfortable, they're in pain, or maybe they're just overstimulated and need a little bit of a break. And as you get used to your baby's cries, you'll learn how to respond to them appropriately. But do expect your baby to cry about a minimum of 4 hours out of each 24-hour period. So that may not be consecutive crying, but 4 hours of crying, little bits here and a little bit there, is going to add up and make you feel like they're crying a lot. Babies also cry more during the evening hours. That is a fact. They get more fussy and they want to eat more between 6 p.m. and 1 a.m. And this is just about the time when you're exhausted and want to go to bed, or you're trying to make dinner and do a few things around the house, and it's frustrating because your baby's crying. So expect all of this. There's many different things that you can do to soothe the baby, and you can talk with your pediatrician and the nurses at the hospital, and they'll be able to give you more advice on that. H is for hormones, and they are definitely going to play a role in how you feel after you've had your baby. Estrogen and progesterone are two hormones that help support pregnancy, and levels decline rapidly after delivery of the baby and placenta. And so about day 5 to 14 after you've had your baby, you are going to feel the effects of this. These hormones, as well as stress hormones, which there's an abundance of after you've had a baby because you're pretty stressed out and worried about everything, the health of your baby, your own health, all of the changes that are happening, these cause actual chemical changes in your brain that will affect your mood. And you're very, very normal if you feel teary, you cry for no reason, you feel a little bit sad, depressed, anxious, maybe a little bit irritable, you're just not feeling yourself. These feelings are called postpartum blues, and they are associated with having a baby, and 80% or more of women experience these feelings within the first 6 weeks after their baby's delivery. However, if these feelings become intense, they last longer than 6 weeks, or they're affecting your ability to function, then you need to talk with your doctor about postpartum depression. Postpartum depression is very real, and it affects 15% of women, and it can onset any time during the first year of the baby's life. So you may feel fine initially, but then 3 to 6 months down the road, you notice that you don't want to take care of yourself. You're withdrawing from friends and family. You don't like things that you used to like to do. Maybe you are resentful of being a mother. Maybe you're having panic attacks or obsessive compulsive tendencies. All of these things can be due to postpartum depression. And just like diabetes, it requires treatment, and your doctor will talk to you about it, and treatment usually comes in the form of medication and/or therapy. It's also important to know that fathers aren't immune to depression either. Studies have shown that 8% of fathers have clinical depression within the first 3 months of their baby's life, and it's actually higher down the road between 6 and 12 months at 10%. I always say that you can be each other's best ally or worst enemy through the adjustment phase, because if the woman has depression, then her partner is more likely to, or vice versa. So be open with your feelings, help each other, work things out, and if that isn't enough, then talk with your doctor about it. P is for plan ahead, and there's many different things to plan for. One thing to think about is picking a pediatrician. You should also pack your hospital bag and get things ready for the baby. A lot of people think about that. You have the baby room all set up, you've got the diaper bag ready to go, you have the car packed, but then when you get home from the hospital, you also need supplies for yourself. It's important to know that you're going to bleed for 3 to 6 weeks after you've had the baby, whether you had a vaginal delivery or a C-section. And you need pads for this. You can't use tampons during this time because it increases the risk of infection. So you need to go to the store and buy a few boxes or bags of the good overnight size pads that hold good volume, and have them available, because heaven forbid you don't know what dad would bring home if you sent him to the store to get them. You also need nursing bras, nipple cream, nursing pads, all of this if you're planning on breastfeeding. And I think it's good to have your mom or mother-in-law around to help you cook, clean, and take care of the baby. It's nice to have someone with experience around. Y is for you. You can't overestimate the power of taking time out for yourself, especially after having a baby, because that baby depends on you for all of their needs, 24 hours every day of the week. And so it is important to take time out for yourself. This might be when they have a nap, or it could be for an hour or two between feedings. Maybe you call a babysitter over and hurry and nurse the baby, and then you know the clock is ticking, but you have an hour or two to go out with your significant other and have some semblance of what life was like before you became a parent. But it's just important to go into it with the mindset that you're going to adjust to new norms. Your life isn't going to be the way it was before, and that's not a bad thing. But you can't often fit your pre-parenthood life into your new life with a newborn, because your house isn't going to be totally clean. Dinner isn't going to be on the table at 6 p.m. sharp. There's going to be loads of laundry everywhere, and all of your cute house decor is going to be replaced with bottles and binkies and burp rags with spit up on them and nursing pads all over the place. Before you know it, that's what's surrounding you. But you're also going to be enveloped with the joy that comes from having a newborn. Those first few months are precious, and it's time you can't ever get back. And speaking from experience, I have 2 kids of my own. You want to slow down time when they get older, and you wish you could go back to those days. So relish them for everything they're worth, and try to be happy by having the right expectations going into it. Reach out to family and friends. Call your pediatrician or OB provider if you have questions about things. Is this normal? Is that normal? There are no stupid questions. And then, of course, you can also ask me questions on our Facebook page at facebook.com/Intermountain Moms and recommend us to your friends and family too.